everyone, I'm Jessica, and for my older adult assessment, I chose to interview my mom. Her name is Rose, and she is 60 years old. She has type 2 diabetes, which she was diagnosed with about 4 years ago. She has relatively normal blood pressure. On the BMI chart, she is considered overweight, and she also has a history of lower back problems. She works full-time, and so she's a pretty busy person. I chose to do the mini mental state examination that helps to determine cognitive function. Since she is still a older adult, she still has a lot of her cognitive function, but she often has a bad memory and has poor recollection of things that happened like 2 days ago. So I decided to do that. However, she did score a perfect 30 out of 30. So that was great. For the determined nutritional assessment, she didn't do so great. She actually did score a score of 12. So to break it down, she scored 2 points for having an illness or condition, diabetes, which changed the kinds of or amount of food that she eats. She also scored 3 more points for eating fewer than 2 meals per day. Like I said, she works full time, and she's gone the majority of the day from 6:30 in the morning till 7 o'clock at night. So she often doesn't have time to eat. She also doesn't have a huge appetite either. She scored 2 more points for eating few fruits and or vegetables and or milk products per day. She scored 2 points for having tooth or mouth problems that make it difficult for her to eat. She actually is in the process of getting full dentures, so hopefully that will help her eat more of a variety of foods and not give her as much trouble. She scored 1 point for taking 3 or more prescribed and or over-the-counter medications per day. She currently takes insulin twice a day as prescribed, and a cholesterol-lowering medication as prescribed as well. She takes vitamin D supplement, which was recommended by her physician. She scored another 2 points for gaining 10 pounds over the last 6 months without wanting to. So overall, like I said, she scored a 12, which puts her at a high risk of nutritional health. So for the nutritional improvement plan, I did recommend that she consumes more fruits and vegetables, of course. Doing that will increase her fiber, and that will help to lower her cholesterol. Also incorporating maybe some oatmeal as well in the mornings. She can do like an overnight oat, which is really easy. So in the morning she could just take it and go while she's on the go in the mornings. Also, to get that dairy in, I did recommend that she starts eating like a non-fat Greek yogurt in the mornings, again on the go. So also I do recommend that she eats more frequently, again to just, whether it's prepping that's the problem or not having appetite, she can eat smaller snacks or meals per day. She often doesn't eat more than once or twice a day, so maybe prepping will really help to increase the amount of food that she eats. The summary of her physical activity and my recommendations, she does get when she takes the train, she walks from the train station to her work office, which is about a quarter mile each way. So of course she walks there and back once per day, 4 days a week. So she's getting a half a mile in per day, which is great. She walks up the stairs once she gets to work, about 70 stairs, and when she goes throughout different offices, she does go up and down the stairs. She doesn't take the elevator. At home we do have stairs, so she does walk up and down the stairs as well throughout the day. So although she does get some physical activity in, we both agree that she could increase the amount of physical activity she does per week. So we recommended probably like walking like once or twice around our neighborhood. It's about 1.5 miles around. So maybe on the weekends when she isn't as active, walking once or twice around the loop per week. I also would like to see her incorporate more weight training, so getting like a 3-pound dumbbell and doing some weight exercises. Also stretching, I think, would really help her back, help improve her lower back problems as well. For recommendations for enhancing her ability to age optimally, I did ask her how she felt about her physician, and while she does like her physician, she actually doesn't care for her diabetic nurse that she sees pretty often. She said that she often makes her feel like she's like she's talking to a child, like she's a child. So she's pretty condescending to her. So I told her that maybe if she had someone that she could talk to, that she would probably utilize the information that she gives her more than someone that is just condescending to her. So also she is pretty a social. She still talks to people from high school, friends from high school. She talks and hangs out with people from work on her days off, and she also socializes and talks to her brothers and sisters. So she, outside of just her immediate family, she does get quite a lot of communication with others and socialization, so that's great. She's also needs to improve a little bit with taking her medications. She used to not be so great. I had to put reminders on her phone, alarms on her phone, to remind her to take her medications regularly. So maybe she just does a little bit better job. She like I said, she has improved, which is great. But my grandma actually passed away. Her mother passed away at 56 because she didn't take care of herself. She didn't eat healthy, and she didn't take her medications regularly. So it's beneficial for my mom. It's actually crucial that she does take care of herself. So a summary of her expected physical and mental health improvement. I think that if she does eat healthier and she does do a little bit more physical activity, that she will feel like she has more energy, and that she will be more active, because she'll have that energy as opposed to just laying on the couch and relaxing on the weekends. If she actually walks and does that physical activity, she'll have more energy. Also, too, I think that she might lose a few pounds as well. Let's see. Also, too, if she were to stick with that, with eating the fiber regularly, perhaps it could help to lower her blood pressure. I'm sorry, not her blood pressure, her cholesterol, which she does take the medication for, and ultimately take her off that medication. That would be wonderful. So my impressions gained from the interview, including any insights. I actually, I'm really glad I got to do this with my mom. I get to see how important it is firsthand to eat healthy and to exercise as well. But it also helps my mom to focus on what she needs to do, because it's one thing to know something, but it's a whole other thing to say it out loud and acknowledge that you have to make changes. So I'm glad I got to do it with her as well. No matter what I do, it's ultimately her that's going to be in charge of her health. Just like we are all in charge of our own health and our futures as far as aging goes. So when we did this assessment, she acknowledged that there's things that she could do to improve her health. So that is, to me, that's the most beneficial thing I can take away from this. Just because the better her health is, the better her quality of life, and the longer she is here with me. So thank you guys for watching. Hope you enjoyed.